Discussing the issues affecting the northwest of England and the Isle of Man now on ITV, this is the Granada debate.
Hello and welcome to the Granada debate. On the programme tonight, as tighter guidance comes to Greater Manchester and Lancashire, is anybody really listening? Do the latest developments put June in jeopardy? We ask one of our region's top scientists. And how do we stop the spread in schools from damaging children's education? Joining me via video link, we have Lisa Nandy, the Labour MP for Wigan and Shadow Foreign Secretary. And here in the studio, Dr Kieran Mullen, the Conservative MP for Crewe and Nantwich, and Professor Tom Solomon, Director of the UK's Emerging Infections Research Unit at the University of Liverpool and an NHS frontline doctor. Thank you for joining me. First, minimise travel and try to meet outdoors. That's the message to people in Greater Manchester and Lancashire as the North West continues to have the highest infection rate in the country, almost 3 times the UK average. So what should and shouldn't you do? Here's how local politicians tried to explain.
It isn't a lockdown. It's saying meet them in the garden, don't meet them indoors. This is guidance. It is advice to the public. It is not a lockdown. It is not a ban.
Will you personally still be inviting people round to your house?
I can't remember the last time that I had anyone round to my house. It just doesn't make sense to have people travelling in and out of the country against the advice of ministers, but with their permission, when we're telling other people that they can't go and hug their families.
Just to stick to the guidelines for Greater Manchester and Lancashire for now, Tom, why has the North West been the worst throughout this pandemic?
I think the first thing to say, actually, just listening to what Lisa was saying, is that she hasn't had people around to her house, and in terms of this new guidance which is being suggested for the North West, I think a lot of people are following these measures anyway across the country. We've been in this pandemic for 18 months now, so people know not to get together in large groups, and I think if you talk to people, a lot of them anyway are being sensible about these things. It's a really interesting question about why the North West seems to have been hit worse throughout the pandemic, and I don't think we know for sure, but there's a mixture of things that might have been contributing to it. We know there's greater virus transmission in areas of deprivation. People who are on lower paid jobs or not employed tend to, firstly, people on lower paid jobs tend to be unable to work at home, and they tend to be doing jobs where they're mixing with the public, so that increases the chances of getting infection. I think also, actually, interestingly, certainly at the start of the pandemic, a lot of the national rules were based on what was happening in London. So, for example, the first lockdown was based on what was happening in London, and then when lockdown eased, that's really when the disease was hitting the North West. So I think a combination of factors.
What's the number one thing in terms of getting these new guidelines to work?
Well, they are guidelines rather than rules. So guidelines, it's always challenging to get those to work because they're guidance. They're not going to be enforced by law. But I think it's really helpful for people to understand, and I think many people do now, 18 months in, they do understand the principles behind these things. They understand you're less at risk if you meet outdoors. You're less at risk even if you do meet somebody, if you keep your distance from them.
Andy Burnham's talked about wanting vaccine more quickly to fast track it to all over 18s. Is that the answer?
I don't think there's going to be a single answer here. I think increasing vaccination is part of the way to control this increased disease in the North West, and I think testing, tracking, tracing, all of those will contribute. In terms of vaccination, we know that what happened in Bolton just last week, there was so much vaccine arriving that they had more than they could cope with. So it's not just simply a matter of pouring in vaccine. For vaccine programmes to work, you have to make sure that they get to the people that need them. And in the North West, part of the problem has been people from deprived communities, maybe people from different ethnic backgrounds who don't have the same ability to drive out to a centre to get the vaccine. And so I think some of these pop-up clinics and mobile vans, I think that's a really good way to go.
Tom, is it unrealistic to say we're going back to normal on June the 21st now?
I would be surprised if on June the 21st we get back to completely normal life. I don't think there's really much chance of that. Even the steps in the roadmap even if we'd done that, I still think there were going to be restrictions on things like big events. But I suspect that the June the 21st step won't happen as it's been described, because there clearly is a risk from increasing transmission of this Delta variant. And I think the critical thing, having listened to those businesses, they would certainly rather move to the next step, but I think it would be really unhelpful for them if we do move to that next step and then 2 or 3 weeks later, because the outbreak is out of control again, we have to move back and have more lockdowns. So I mean, we have to wait and see what the data show, and on the 14th we're going to hear, but all the data I've looked at suggests it's unlikely we'll be having that step on June the 21st.
Do you worry that if we were to unlock completely on June the 21st, we might actually end up in lockdown again? Is there a real risk of that?
Yeah, because the problem is, if we at the moment we know that the vaccine program has been brilliant, and that is bringing the pandemic to an end as far as this country is concerned, but we still have about 20% of adults who've not had a single vaccine, and 50% have only had one shot. So if you imagine that suddenly going to stage 4 and then allowing the virus to run wild, if all those people who haven't been protected became infected and ill in a very short time, the hospitals potentially could be overwhelmed. And it's because this Delta variant is so transmissible that there is the worry that so many people would become infected in such a short time that the hospitals would be overwhelmed. And I think if we do have to slow down, that will be the reason why. It's just to give us more time to vaccinate more people.
Kieran, what's your personal judgment on whether or not we should open up as things stand at the moment?
Ultimately, I think if it's a matter of a few more weeks, because the vaccine programme is really kind of proceeding at pace, if a few more weeks buy an awful lot of certainty and that reassurance that we won't get a spike, then I'll be open to that.
That could have paid for this education catch-up plan 3 times over. It's time for the government to decide where their priorities lie and whose side they're on.
The government is a bit more responsible, and what it's actually said very clearly is it wants to look at the evidence base for things like extending the school day before taking a final decision. And I think that's a reasonable thing to say. They haven't said no yet. They've said let's see what works in the short term. Then there is evidence that the tutoring works, and they've backed that. So I think it's about those how we approach it.
Can I just ask, how do you explain the fact that the person the government asked to look at this recommended 14 billion, and then the government came up with just 1.4 billion, and the person who chaired that review subsequently resigned? Credit to him for actually showing some standards in that sense.
Obviously as a government you have to take a step back and look at all of government income and expenditure. You can't look at things in isolation as the government. As I said, I'm expecting more. I think most MPs are expecting more to come. The government said that there's going to be more to come. Just because we haven't met his timetable for when that comes, I'm afraid isn't necessarily a reason to say that we've done the wrong thing.
So you think 14 billion will come over?
Well, I think more money will come. It will depend on what evidence we're able to procure about what actually works, and that's what I'm focused on.
Don't lecture me about extending the school day. We put forward a plan this week in Parliament that recommended that it is an absolute nonsense. That's the money.
I just want to bring in Tom very, very briefly while we've still got time. Given the numbers of children who are currently off school in the Northwest, 31% of secondary pupils were absent in Bolton on a single day because of COVID. Given those numbers, should we be giving children the vaccine as soon as possible?
Well, the MHRA, the regulator, has said it will be safe and effective to vaccinate children in the group from age 12 to 15. It's being done in America and Canada. The EU have approved it. So we're just in this country waiting for the JCVI, the Joint Committee on Vaccines and Immunisations, to make a recommendation. I personally think they should be vaccinated. They've suffered enormously. They are at risk of disease, and of course the vaccine protects them as individuals. It also protects their families and the whole community, so that we can come out of this lockdown.
OK, we'll wrap it up there. Thanks to Kieran Mullen, Tom Solomon and Lisa Nandy for joining me. Thank you for watching. I'll be back next month. Until then, goodbye.